I am Naranjan Dhalla from Winnipeg. I am a distinguished professor of the University of Manitoba, and I'm also executive director of the International Academy of Cardiovascular Sciences. I talked about the mechanisms of diabetic cardiomyopathy. You see what happens that most of the population who are diabetics, they end up in heart dysfunction. I talked about how can we understand this mechanism so that proper therapy can be instituted to cure that. And what happened, but previously we have shown that there are two mechanisms which were important for treatment of diabetic cardiomyopathy, and that was one was the activation of renin-angiotensin system, and so ACE inhibitors and the blockers of the angiotensin receptors could be very useful for curing this problem. Then we have already published quite extensive data showing that there is an activation of sympathetic nervous system, and this activation of sympathetic nervous system leads to deterioration of cardiac function, and this can be also prevented by the sympathetic nervous system blocking agents. And today I presented a very interesting feature. We showed that the antiplatelet therapy could be very useful for preventing cardiovascular dysfunction in diabetes. And I showed that the agent like serpoglate, which is a antiplatelet agent acting through on the serotonin receptors, could be useful because it does prevent the deterioration of cardiac function, and it does it because it promotes the utilization of glucose. And so this may be another adjunct therapy to the already well-known insulin doses people are having with the diabetic patients.